My name's Brianna Durand. My pronouns are she, her. I am a doctor of physical therapy located in Seattle, Washington. I work specifically with folks in the LGBTQ plus community, and I really love providing care for folks who are transgender, whether they're on hormones or getting surgery or not. I love that I live in an area where I am surrounded by other folks in my community and that I get to serve them. Gender expansive folks are often overlooked in the pelvic floor sphere, even though everybody has a pelvis, and there's a lot of ways that PTs can be really impactful with that community. A lot of trans folks and even gender nonconforming individuals will avoid using public restrooms for fear of, at best, dirty looks and at worst, physical violence. When someone doesn't go to the bathroom regularly, it can influence the tone of the pelvic floor. It can also contribute to things like infections. And so that can absolutely lead to pain and discomfort later. Then for folks who do have the medical transition piece, for example, transmasculine individuals who do take testosterone, we now, just as of last year, have some really interesting data showing the prevalence of pelvic pain in transmasculine individuals, especially transmasculine people who have penetrative vaginal sex, because of how it atrophies the vaginal tissue, makes it drier, more easy to tear. And so there's lots of relevance there. For trans feminine people or folks assigned male at birth who still have a penis and engage in things like tucking, which is to create a flat front surface, that can absolutely increase pelvic floor dysfunction. It can increase the risk of urinary tract infections because of the position of the urethra close to the anus, but also just the amount of pulling and pressure on the fascia, on the muscles. And we do have some interesting studies showing that folks who get vaginoplasty, who have pelvic floor dysfunction before surgery, still are likely to have it after surgery. And fortunately, one of the ways that pelvic floor PTs are being most utilized to serve trans people is specifically in the role of pre and post-op vaginoplasty, using dilators, for example, which we often hear about for cisgender heterosexual women who are having pain with intercourse. Can also be very relevant for folks who have a surgically created vagina and want to use that vagina for sex later. Chest binding is a practice that's often done by folks assigned female at birth who may be non-binary or more androgynous, agender, transmasculine. They want to create a flatter surface of the chest, and so they will flatten the chest tissue in a variety of ways. Ideally, using a commercial binder is the healthiest way to do it, as opposed to using something like saran wrap, ace bandage, duct tape. Just like with tucking, instead of using tape, there's something called a gaff, which can actually have something that can make it easy for someone to go to the bathroom, because once someone has tucked, if it's taped, they don't want to take it off. With chest binding, there are commercial binders, which can be much safer than just trying to double up a tight sports bra. And there are ways to position the chest tissue. Generally, to the side is better than just straight down. But either way, binding, especially for folks who have larger tissue, it can restrict the movement of the rib cage and the diaphragm. And most pelvic floor PTs will talk to you about how important the diaphragm is for pelvic floor health, because the diaphragm and the pelvic floor should move in synchronization. And so if the diaphragm and the rib cage cannot move properly, we have changes in the pressure inside the abdomen, which can impair how the pelvic floor is able to move and contract. And folks don't even have to bind to do this. Folks who don't have access to binding but have large chest and like to really round here, that also compresses the ribcage and the diaphragm. It's really hard to just take a deep breath in this position. And so there's lots of influences, not to mention just how it impacts the pulling of the tissue and the skin and the fascia, and how it can influence their outcomes with top surgery down the line should they choose to get it. As it relates specifically to treating queer and trans people, a lot of people don't talk about it because queer and trans people just aren't covered in schools, period. When I was in grad school, I founded an organization within the American Physical Therapy Association because I was privileged enough to go to conferences and meet other students. And in talking to them, I realized nobody had equal coverage of LGBTQ issues in school. Some people had a semester, some people had a guest lecture, but most programs, including my own, had zero mention of this community. And then when I was in school and we started learning about how hormones influence things like ACL tear risk, my mind started wondering, like, well, what about folks who take exogenous hormones, like folks who are trans? And none of my professors had answers for me. They were all really supportive in me looking for it on my own, but nobody seemed to know. No one was talking about it. There really has only been this groundswell of research and discussion in the last decade or so. So in terms of how we can change it, one, I think that it needs to be more discussed in graduate programs in school. And then there needs to be more con ed about it. So I create continuing education specifically on this topic, but I only know a handful of other creators who do a similar topic versus if you were to look at ACL rehab, there's thousands of courses. So I do think it's changeable, but I think a lot of providers would like to serve this community. They're just afraid to cause harm because they don't feel like they know enough. And even if they wanted to learn more, there's just not a lot of opportunities to do it. I think it depends heavily on geography. The cool thing though is that since I graduated PT school, there are more pelvic floor PTs than ever. So there are more of us, which is wonderful. And I think in terms of trying to find someone who's going to be able to serve you in an affirming way, the folks who have found me, almost all of them have found me through other queer and trans people or through a network of providers. So if you are a queer or trans person looking for an affirming pelvic floor therapist, folks find us on subreddits, on Facebook exchanges, on message boards, because the world is quite small. And once a PT is known for providing affirming care to the community, word spreads. And so I would encourage folks to reach out to their local community and see if anyone has had pelvic floor care in the past. And if not, the internet is your best friend in this regard. I really wish there was a directory that we could give you. Unfortunately, it's been working on for the last several years, it's been worked on. There is a directory of pelvic floor therapists, pelvic rehab, but you can't search by affirming care. But things I look for in the bio are like pelvic floor PT for all genders, if they don't explicitly say they serve the LGBTQ plus community. So I would start with pelvic rehab. And then there are some local areas. So I'm in the Pacific Northwest, and there's a really phenomenal virtual clinic called Queer Doc that has a directory of pelvic floor therapists for all the states that they serve, which is a growing number. I think it's over 15 at this point. If you're on the coast, you're going to probably have a little bit easier of time because there are more resources there. But a lot of PTs do virtual visits at this point. And if not, having some type of virtual check-in with an affirming provider while seeing someone in person. I've done that a lot, helping to coach someone through how to navigate their care remotely, but then getting the actual physical work done in person. We have so much evidence. We know that there are a lot of microaggressions committed by medical providers towards queer and trans people. And we know that that creates a pattern of behavior of avoiding care and avoiding preventative care. You are worth getting care. It is going to be more difficult for you to find someone who is more affirming, but it is so worth it if you can find that provider. And you absolutely do not have to stick with a provider who is not affirming to you. It is not your responsibility to educate your provider. It is not your responsibility to tolerate misgendering or being called by your dead name. You have absolutely every right to ask the provider if they've treated folks like you in the past. You have every right to get a second opinion. And also, if you have a negative experience, while it makes sense that you may want to postpone care, I highly encourage you to try to seek out folks who will provide the care that you deserve.